Assalamu alaikum. It's a series of lecture regarding gynecology. Now I would like to discuss about the OCP. What is OCP means? OCP means oral combined pill, and the combinations are estrogen and progesterone. So combined estrogen, progesterone, uh, oral contraceptive, and the progestin vaginal ring can worsening pre-existing hypertension due to estrogen-induced angiotensin synthesis. These estrogen-induced angiotensin synthesis can worsen hypertension. Very high thought. Therefore, estrogen-containing contraceptives are absolute contraindication in severe hypertension and a relative contraindication in or mild or medication control hypertension. Those who develop hypertension while taking oral contraceptives should discontinue the medication. The physician should have a decision with the patient about the benefit about stopping OCPs. The risks of a drug continues in an alternate contraceptive method. If elevated blood pressure persists after OCD discontinuation, lifestyle modification, medication, low dose diuretics may be required. Now, what are the side effects and risks of combination of OCPs? There may be breakthrough bleeding, breast tenderness, amenorrhea, hypertension, venous thromboembolic disease, decreased risk of ovarian and endometrial cancer, increased risk of cervical cancer, liver disease. There may be hepatic adenoma. This is very high. The hepatic adenoma can happen due to OCPs, and increased risk of cervical cancer, and increase TG due to estrogen component. Increased estrogen can cause angiogenesis. This increased estrogen can cause angiotensin synthesis, and these angiotensin synthesis can cause hypertension, and there may be hypertension, venous thromboembolic disease, and the most important that it can cause increased TG synthesis due to estrogen component. It can cause increased TGs. Early side effects of nausea, bloating, breast tenderness, which usually improve with their continued use. Breakthrough bleeding is the most common side effect and is associated with lower estrogen doses. Weight gain is not at weight gain is usually not an adverse effect. Weight gain is not an adverse effect. What are the absolute contraindications? This is an emergency box. You have to know that advanced breast cancer, in a inactive advanced breast cancer, you should not give OCPs. Migraine with aura, uncontrolled hypertension, uncontrolled migraine with aura, uncontrolled hypertension more than 160 by 100, acute hepatitis, severe cirrhosis, liver cancer, age more than 35, and more than 15 cigarettes per day, ischemic heart disease, stroke, less than 3 weeks of postpartum, Prolonged immobilization, like with major surgery, thrombophilia, factor V, Leiden, antiphospholipid antibody syndrome, venous thromboembolism, and diabetes mellitus with end organ damage. Diabetes mellitus with end organ damage. So these are the emergency side effects. So this is the emergency box about absolute contraindication of the OCP. What we should remember: active breast cancer can cause serious problems, so it is contraindicated to take is OCP in active breast cancer. Migraine with aura, uncontrolled hypertension, ischemic heart disease less than 3 weeks of postpartum, prolonged immobilization like with major surgery, thrombophilia, factor V, Leiden, antiphospholipid antibody syndrome, venous thromboembolism, diabetes with end organ damage. Patients with these conditions should be placed on hormone-free contraceptive. They should be placed on hormone-free contraceptive, that is copper iodine. Condoms with spermicide are safe, and hormone-free options have the lowest efficacy rate of all contraceptive options. Combined OCPs, combined hormone contraception. Absolute and relative. Absolute contraindication with migraine with aura, severe hypertension, migraine with aura, severe hypertension, ischemic heart disease or stroke, age more equal 35, smoking more than 15 cigarettes per day, less than 3 weeks of postpartum, thromboembolism, thrombophilia, factor V, Leiden, antiphospholipid antibody syndrome, active breast cancer, active or severe liver disease, active or severe liver disease. These are the absolute contraindication: migraine with aura, severe hypertension, ischemic heart disease, and stroke, age more than 35, and smoking more than 15 cigarettes per day, less than 3 weeks of postpartum, thromboembolism, thrombophilia, active breast cancer, active or severe active or severe liver disease, active or severe liver disease. Relative is mild or medication control, hypertension, age more than 35, smoking less than 15 cigarettes per day, certain medication, lamotrigine and rifampin, inherited thrombophilia carrier, family member with thrombophilia plus, family member with thrombophilia plus thromboembolism, with thrombophilia plus thromboembolism. Now, estrogen, progesterone contraception benefits and risks. Risks are very important: venous thromboembolism, hypertension, hepatic adenoma, stroke MI, cervical cancer, hypertension, hepatic adenoma, and cervical cancer. Hypertension, hepatic adenoma, cervical cancer, stroke MI. These are the risks for estrogen, progesterone contraceptives. OCP decreases the risk of benign breast disease. OCP decreases the risk of benign breast disease, particularly fibroadenoma and fibrocystic disease. A history of benign breast disease or a family history of breast cancer is not a contraindication. Or a family history of breast cancer is not a contraindication of OCP. This is very high health thought. That if a woman comes with a complaints of fibrocystic disease, she already knows how she already knew her diagnosis, uh, that she has fibrocystic disease or fibroadenoma. And then she came to me with the complaints of, can I use OCP? Yes, you can. If your family has a breast cancer history, use, yes, you can. But if you have active breast cancer, then you should not use. Or if your family has somebody has active cancer, active breast cancer, they cannot use OCPs. They can use other forms of they can use other forms of contraception, like any forms of barrier jelly or T-tube can be used. Long-term combinations of OCP is associated with slight increased risk of cervical and breast cancer. The increased risk returns to normal within the 10 years of OCP. The increased risk returns to normal within 10 years. If I stop OCP, how much time I need to be as normal as it was before? The answer would be 10 years. Then medroxyprogesterone acetate, DMPA. In depot, medroxyprogesterone acetate takes the following into consideration: that preference and ease of ease of use, inability to adhere to daily pill schedule, inability to adhere to daily pill schedule, uterine cavity distortion, desire for future fertility, inability to adhere a daily pill schedule. If you don't want to take a daily pill, then you can use DMPA. Uterine cavity distortion such as biconjugate uterus, which is contraindication to use of IUD. Uterine cavity distortion. In here, you cannot use IUDs. And desire for future fertility, which is possible with DMPA cessation, and return to fertility variable from 6 to 18 months when the patient desires pregnancy. That time is crucial. And as you are taking some drugs, some anti-fertility drugs, and you stop, but it actually takes 6 to 18 months to come to gain back the fertility gain. DMP is effective injectable contraceptive that do not require daily administration. It is safe for women, particularly who have contraindication of IOD or estrogen containing contraceptive. DMP is given injection every 3 months. A common side effect is light, irregular vaginal bleeding, amenorrhea, light, irregular vaginal bleeding. Depot medroxyprogesterone acetate is administered intramuscularly every 3 months to prevent pregnancy by inhibiting the release of gonadotropin releasing hormone from the hypothalamus and suppressing ovulation. DMPA causes menstrual irregularity and prolonged bleeding and spotting. During the first 6 months, about 50% women have amenorrhea after 1 year. Less common side effect: weight gain, fatigue, nausea, breast tenderness. Weight gain, fatigue, nausea, breast tenderness. Women with these symptoms typically experience mm, them throughout the MPU. Side effects is breast tenderness, weight gain. A woman of a childbearing age with the absence of mens more than 1 month should be evaluated for pregnancy. If pregnancy is ruled out, an alternate method of contraception with a better side effect profile, non-hormonal copper iod should be offered. Non-hormonal copper iod should be offered. The subdermal progesterone implant is a good option for this patient. It can increase weight, hence not prescribed to those who wants to lose weight. So this type of drugs, non-hormonal copper iod, can cause weight gain. So those who wants to lose weight, they cannot give such sort of drugs. POP, progesterone contraceptive pill, are commonly used in women who are breastfeeding because they are safe, they have few contraindications. However, they are not consistently inhibit ovulation and a high failure rate, 6% failure rate because of short half-life that trigger strict adherence to daily schedule. More than 3 hours late requires backup contraception. Progesterone can have intolerable side effects like severe nausea may lead to discontinuation. These are the emergency contraceptives like copper iodine 0 to 122 hour time after intercourse, copper containing iodine more than 99% efficacy. Oleprostol has same efficacy 0 to 120, levonorgestrel 0 to 70, OCP 0 to 72. So levonorgestrel and OCP has 3 days timing and it has 5 days timing. Copper iodine cannot be given in active pelvic infection, severe uterine cavity distortion, Wilson disease, because Wilson disease has a copper problem, copper metabolism, and you are giving copper outside, and it may cause serious problem. In Wilson, you can use copper disease, copper containing iodine active PID, severe uterine cavity, complicated organ transplant failure. Patients who have recent unprotected intercourse may be the candidates of maybe they can postcoital or emergency contraceptives for pregnancy prevention. So these four are emergency contraceptives they can use in unprotected intercourse. Levonorgestrel and OCP 0 to 3 days and Oleprostol and copper iodine 0 to 5 days. Patients determines eligibility for EC criteria. Emergency contraception patient with positive pregnancy determines patients with positive pregnancy test are not candidates of emergency contraceptive. In contrast, negative pregnancy tests are still risk of unintended pregnancy and still risk of unintended pregnancy are candidates for emergency contraceptive. Oleprostol progesterone receptor blocker that prevents pregnancy by delaying ovulation and impairing implantation. Single dose of it can be taken up to 120 hours after unprotected intercourse. However, it should be administered as soon as possible because its effectiveness decreases with time. The levonorgestrel is the most readily available form of emergency contraception. Highest high dose levonorgestrel in these pills prevents pregnancy by inhibiting LH cells and thereby delaying ovulation. Combined OCP commonly used precoital precoital contraception may be used in emergency contraceptives. Taking multiple pills simultaneously to achieve the progesterone level required to delay ovulation. However, the high estrogen content typically have intolerable side effects. Now, postpartum contraception. In postpartum contraception, it is based on time from delivery, breastfeeding status, patient-specific risk factor, and desire for future fertility. In patients who are less than 1 month of postpartum, estrogen-containing contraceptives are avoided because they increase the risk of estrogen-containing contraceptives causes increase the risk of estrogen-containing contraceptives can increase the risk of thromboembolism. So in patient less than 1 month of postpartum, estrogen contraceptives are avoided. They can negatively affect breastfeeding too. Non-hormonal copper, IUD, and progesterone-only contraceptive are preferred less than 1 month. Copper-containing IUD is avoided if patients have heavy menstrual bleeding. In contrast, progestin-only contraception methods help to decrease the menstrual bleeding, which also providing contraception. The best contraceptive is subdermal progestin releasing implant. A long-acting reversible contraceptive. The long-acting reversible contraceptive that have high efficacy more than 99% for pregnancy prevention. It does not increase thromboembolic risk or affect breastfeeding and can be inserted immediately postpartum and kept in place for up to 3 years. The subdermal progestin implant has side effect and irregular mens and breast tenderness. Progestin only contraceptives do not affect breastfeeding and thromboembolism break. However, they are less effective than the for the pregnancy prevention than the subdermal progestin releasing implant due to high risk of error and short time after medication. Levonorgestrel IOD provides high efficacy, long-acting reversible contraceptive that works by thickening the cervical mucus. Impure progestin containing IOD have added benefit of amenorrhea and minimal side effect, hence preferred in those with anemia and history of mens. So progestin containing IOD have added benefit for amenorrhea. This is subdermal progestin implant. This is subdermal progestin implant, medial epicondyle, 8 to 10 centimeter insertion tract, insertion site and implantation. Adolescent with disabilities. Adolescent with disabilities may become dependent on caregiver for menstrual hygiene, limiting their independence and creating embarrassment, especially when they are heavy menstrual bleeding, frequent patches, and severe menstrual management with hormonal contraception. Menstrual management with hormonal contraception combined OCP can be used to minimize menstrual bleeding, menstrual blood volume or frequency, and thereby improving the patient's quality of life. Hormonal contraceptive should not be given. Estrogen containing contraceptive contraindicated in migraine with aura due to increased risk of stroke. Progesterone releasing subdermal implant long acting up to 3 years. Reversing contraception reduce menstrual bleeding in 50% patient and causing amenorrhea in 20% because it can easily place in the upper arm. It's an ideal contraception option for adolescents, particularly those with difficulty with pelvic examination and lower extremity. Uh,